Welcome to Healthcare One, your trusted source for health information that can really make a difference. Today's video isn't just another health talk. It could save your life. Your kidneys may be small, but they perform major miracles every day. Kidneys perform a variety of functions in our bodies. Some of them are, they filter toxins, regulate blood pressure, balance minerals, maintain bone strength, and even keep your heart healthy. But here's the scary truth. According to the World Health Organization, more than 850 million people worldwide suffer from kidney disease, and most don't know it until it's too late. When your kidneys start to fail, the effects spread throughout your body. You can develop uncontrolled high blood pressure, heart disease, weak and brittle bones, nerve damage, extreme fatigue, shortness of breath, and in the worst cases, even premature death. The scary part, kidney failure often develops silently. The early symptoms are subtle, and most people ignore them. That's why in today's video, we're revealing 13 early warning signs of kidney failure that you should never ignore. Each of these signs is your body's way of screaming for help, and knowing them can be the difference between catching kidney disease early and living a healthy life, or finding out too late. Stay with me until the end, because the last sign is the most overlooked and deadly. Without further ado, let's take a look at the early warning signs of kidney failure one by one. Number 1. Persistent fatigue and weakness. Have you ever felt constantly tired, even after getting a full night's sleep? This isn't just ordinary tiredness. It could be a warning sign of kidney problems. When your kidneys don't filter properly, toxins and waste start building up in your blood. This makes your body feel heavy, sluggish, and drained of energy. According to the National Kidney Foundation, 2023, another reason for this weakness is that damaged kidneys produce less of a hormone called erythropoietin, which helps your body create red blood cells. With fewer red blood cells, less oxygen reaches your muscles and brain, leaving you exhausted and struggling to focus. If ignored, this fatigue can progress into severe anemia, poor concentration, and even heart strain. So if you're always feeling weak for no clear reason, don't just brush it off. Your kidneys may be silently crying for help. Number 2. Swelling in feet, ankles, and hands. Ever noticed your shoes feeling tighter at the end of the day? Or your fingers looking puffier than usual? This isn't always from too much salt. It could be kidney trouble. When kidneys can't remove excess fluid, it collects in tissues, especially around the feet and ankles. The Mayo Clinic 2024 explains that fluid buildup can also spread to the lungs, making breathing harder. Swelling keeps coming back. It's a strong signal your kidneys aren't doing their job. Left unchecked, it can progress into dangerous fluid overload, high blood pressure, and heart failure. Number 3. Changes in urination. Your bathroom habits tell you a lot about your kidney health. If you're going more often at night, seeing foamy urine, or barely passing any urine, that's a red flag. Foamy urine, for instance, suggests protein leakage as a sign of kidney damage. Research in the Journal of the American Society of Nephrology 2023 found that early kidney disease often shows up in urine changes before blood tests reveal it. Ignoring these symptoms can mean protein loss, dehydration, and long-term kidney decline. Pay attention to what your body is telling you. Number 4. Shortness of breath. You get out of breath doing small tasks like climbing a few stairs? It might not just be age or fitness. Weak kidneys allow fluid to build up in the lungs, making it hard to breathe. On top of that, reduced red blood cells mean your body isn't carrying enough oxygen. The Cleveland Clinic reports that kidney-related shortness of breath can lead to pulmonary edema fluid filling the lungs. If ignored, this can escalate to dangerous respiratory distress and even heart enlargement. So if breathing feels harder than it used to, don't wait, get it checked. Number 5. Puffy eyes. Waking up with swollen eyes isn't always about lack of sleep. It could mean your kidneys are leaking protein into your urine instead of keeping it in the body where it's needed. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, highlights that this is one of the earliest signs of kidney damage. Over time, protein loss can weaken your muscles, reduce immunity, and even cause brittle bones. If your eyes are always puffy, especially in the mornings, it's worth taking seriously. Number 6. Nausea and vomiting. When waste products build up in your blood, a condition called uremia develops. This often causes nausea, vomiting, and even loss of appetite. According to the Mayo Clinic, many patients with chronic kidney disease report feeling constantly sick to their stomach. If untreated, this can lead to sudden weight loss, dehydration, and malnutrition. Over time, poor nutrition weakens your immune system and speeds up kidney decline. If food starts tasting off or you're feeling nauseous without reason, it might be your kidneys. Number 7. Metallic taste in mouth and bad breath. Have you ever noticed a metallic taste in your mouth or breath that smells like ammonia? That's often linked to kidney failure. When toxins build up, they affect your taste buds and saliva. The National Kidney Foundation notes that many patients report food tasting strange, leading them to eat less. Over time, this can cause poor nutrition, weight loss, and lower immunity. If even your favorite foods start tasting unpleasant, don't ignore it. TIT could be more than just a dental issue. Number 8. Itchy and dry skin. Persistent itching and dry skin may not just be about allergies or whether it can signal kidney imbalance. Failing kidneys can't balance calcium and phosphorus levels, leading to itchy, irritated skin. According to the American Journal of Kidney Diseases 2022, this condition, called renal pruritus, is very common in kidney patients. If ignored, it can develop into renal bone disease, causing weak and fragile bones. So, if the itching just won't go away, it's time to look deeper. Number 9. High blood pressure. Your kidneys play a major role in controlling blood pressure by balancing salt and fluids. When they're damaged, blood pressure can skyrocket. The American Heart Association confirms that high blood pressure both causes and worsens kidney disease, creating a dangerous cycle. Left untreated, this raises the risk of stroke, heart attack, and further kidney damage. If you're struggling with hypertension despite medication, your kidneys could be involved. Next, number 10. Difficulty concentrating and brain fog. Do you ever feel like your brain just isn't as sharp? Kidney failure can cause this too. When anemia develops, less oxygen reaches your brain, causing dizziness, poor memory, and trouble focusing. The National Institutes of Health (NIH) has shown that kidney patients often experience cognitive decline earlier than others. If ignored, this can progress to nerve damage and long-term memory problems. Brain fog is not just stress, it may be tied to your kidneys. Number 11. Loss of appetite and weight loss. When kidneys fail, toxins affect taste and smell, making food less appealing. According to the Mayo Clinic, many people with chronic kidney disease experience poor appetite and gradual weight loss. Over time, this can cause muscle wasting, malnutrition, and a weakened immune system. If you're eating less without trying to lose weight, it's worth investigating. Number 12. Muscle cramps and twitches. Kidneys regulate electrolytes like calcium, potassium, and sodium, and when they fail, these minerals go out of balance, leading to muscle cramps, twitches, or restless legs at night. The Cleveland Clinic notes that severe potassium imbalance can cause dangerous heart rhythm problems or even sudden cardiac arrest. Don't ignore frequent cramps. They may not just be from dehydration. Number 13. Chest pain or irregular heartbeat. This is one of the most serious signs. Stitties. When potassium builds up in the blood due to kidney failure, it can disrupt the heart's rhythm. Fluid can also accumulate around the heart, causing chest pain. The Mayo Clinic 2024 warns that untreated cases may lead to cardiac arrest. If you feel chest pain or irregular heartbeat, seek emergency help. It's a life-threatening complication of kidney disease. Conclusion: these were the 13 early signs of kidney failure that often go unnoticed. Each of them might seem small on its own: tiredness, swelling, nausea, but together they paint a clear picture. If you notice 2 or more of these symptoms, don't wait. Talk to your doctor and request kidney function tests like creatinine, eGFR, and urine analysis. The earlier kidney disease is detected, the better the chances of slowing it down and avoiding serious complications like heart disease, bone weakness, or even early death. At Healthcare One, we're here to give you practical, life-saving health information. If this video helped you, please like, share, and subscribe, because awareness can truly save lives. Stay healthy, stay aware, and I'll see you in the next video.